Being different can be difficult on a kid, especially when they have a visible deformity.
Yes, but an incredible new surgery is improving the lives of some of these children, children with deformed ears.
Here's Fox 5's Dr. Steve Salvatore.
You know, kids are kids. Some are mean, some are nice.
Rosanna Mara remembers how difficult it was for her son Sal just to go to school.
You know, it used to break my heart when he came home from school and he'd say, you know, this child said this, and I heard people in the hallway saying this. It's very upsetting.
Sal was born with Microtia, a deformity of the ear that's usually associated with deafness. It occurs in about 1 in every 5,000 children.
The children are born with a small piece of skin that looks like an ear, and that's all they have. They don't have an ear, and they don't have an ear canal.
Dr. Thomas Romo is the head of facial, plastic, and reconstructive surgery at Lenox Hill Hospital and a pioneer in ear reconstruction. He developed a new procedure that uses a special implant made of porous plastic that does not get rejected by the body.
The pore size is like a Swiss cheese, and so it allows for the body to actually grow into the implant itself and fight infections and fight extrusion, which makes it a very safe and stable implant.
Repairing a deformed ear doesn't just improve the appearance. Dr. Romo also adds a special hearing aid that restores hearing in these children.
This is a very new, innovative type of hearing aid called a bone-anchored hearing aid. And it had never been applied to children, and it had never been applied to children with Microtia.
What's it like now that you've got your new ear? I mean, it's got to feel good.
Yeah, well, yes, in some ways it does. Like, when I'm on the field playing soccer, kids don't notice me as much as they used to.
Today, when we do these procedures on these children and they're coming out and they can hear and they have an ear, and you see how positive they are, and at the same time they've spent 1.5 days in the hospital for all their surgery. It's a great feedback from me, for them.
With his new ear, Sal has more friends, is more social and more confident. And there's this.
Now, I understand there's one thing that you can do now that you couldn't do before. What is it? Oh, that looks cool.
Dr. Steve Salvatore, Fox 5 News.